And it's no secret doctors and nurses have been facing extreme fatigue as we near 2 years now into this pandemic.
Yeah, we told you about those longer wait times in emergency rooms last night. Now we are seeing another issue, an unprecedented demand in telemedicine. Victoria Saha joining us now live in studio with a look at that growing problem. Victoria?
These are just the wait times right now at our local emergency rooms. Although they may not seem too extreme, it's just another part of the problem. We see patients in emergency rooms that don't need to be in there, or patients utilizing telehealth medicine when they should actually be seeing a doctor in person. The thought of communicating with your doctor from the comfort of your home sounds very enticing, but that convenience has led to doctors now feeling what they are calling Zoom fatigue.
Well, I'm swamped with patients at all times. It's really a non-stop influx of patients.
Dr. Alexandria Lightning owns her own medical practice. After working 40 hours a week seeing in-person patients, she adds on an additional 30 hours of telehealth.
They stay consistently every 20 minutes, somebody else booking an appointment.
She sees up to 10 telehealth patients a night.
There's no room to stop.
Dr. Lightning says a majority of her telehealth patients have conditions that warrant them to come in person to her office so she can examine them fully.
We want to be able to use all our senses and resources that we have to treat the patient, and that really is best fit with an in-person visit.
Mental health professionals are also dealing with an overload in telehealth patients.
In most cases, we are kind of packed to the brim.
Lakeisha Oliver, a clinician with the Solutions of Change, says the pandemic has caused a lot of mental health needs, and most therapists are doing their best to accommodate.
We also have to think of the mental well-being of the clinicians, and so there are people who are overloaded.
Now, there are solutions to this. Dr. Lightning says we can help take off some of the load on local emergency rooms and telehealth professionals if we are set up with a primary care physician. That way conditions don't worsen and lead to a visit to the ER. Telehealth is best for simpler needs such as a prescription refill. As for seeking mental health help, there could be a long wait list, but Oliver says in the meantime, joining a support group could be your next avenue. Denise?